am excited that this neonatal integration is finally happening. I think it's long overdue. I think that we have a great opportunity to really identify where it is that we should be applying resources to ensure that our newborns have the best possible outcomes.
Nigeria has a very high neonatal mortality rate, which is 41%. Rather than improving, our recent statistics show that neonatal mortality rate is actually increasing and is one of the highest in the world. Majority of our babies are delivered out of hospital. About 60% of cases are out of facility deliveries. And because of that, these babies do not have access to the required adequate neonatal resuscitation and care. So a lot of them are brought in very late, and when they do come in late, most of the parents are unable to afford care.
I hope that nationwide we see a difference in our newborn mortality rates because our babies deserve better.
We know that about 40% of infant mortality is accounted for by, neonatal deaths. And there's a lot of inequity in neonatal deaths where we see families that are poorer, more vulnerable, have less access to it. So on our journey to universal health coverage, if Nigeria is to make significant progress, we have to address the issue of neonatal mortality. And this fits very well within our strategic framework that looks at coverage, equity, and quality of services as principal focus areas for the NHIA. On coverage is to make sure that more Nigerians are covered, with health insurance or at least a form of financial protection. For equity, to make sure that as we expand coverage, it doesn't go only to those who are well off, that we're not leaving the poor and vulnerable behind. And this was the premise for starting the program obstetric fistula, as well as the access to CEmONC services for women at risk of dying in childbirth. But as we know, if you treat a woman and she delivers and she's better, but her child is sick, you've not really discharged her. So the neonatal component is a critical one. And we're really grateful to the Federal Ministry of Health and Social Welfare and the Department of Family Health, particularly the nutrition desk, in working closely with us in defining this program. We're also appreciative of, the Pediatric Association of Nigeria and other well-meaning pediatricians and neonatologists who are partnering with the NHIA to make sure that this program is successful. Hopefully, at the end of this, we'll be able to design a robust program to ensure that neonates do not die from things that lend themselves to intervention as a reason or as a result of not being able to afford it. As NHIA, our focus is on financial access to good quality care. And we hope that through this program, poorer families and more vulnerable families will have financial access to life-saving neonatal interventions. So I'm really looking forward to the outcome of this 2-day workshop. And we definitely intend to take the outputs and run with it this month, because every Nigerian child's life is really important and we must do what we can to save those lives.